Hi there, I'm Dr. Jim. Thank you for stopping by. Today's topic is managing multiple sclerosis in senior care. And I want to get right to the information. Very important topic. Multiple sclerosis is a chronic, disabling, and progressive neurodegenerative disease that affects both the brain and the spinal cord. And it is characterized as an autoimmune, inflammatory, and demyelinating of the brain and spinal cord, with progressive loss of both neurons and axons. I looked at the National Multiple Sclerosis Society's website. I was curious to see how they described the disease. And here's what they said. Quote, multiple sclerosis is an unpredictable, often disabling disease of the central nervous system that disrupts the flow of information within the brain and between the brain and the body. End of quote. Unfortunately, there is no cure, but there are some treatments available to provide two important things: comfort and quality of life. The disease does require ongoing care and eventually assistance with basic daily living, things like ADLs, activities of daily life. The average life expectancy is between 5 to 10 years lower than people who do not have MS. So multiple sclerosis does steal 5 to 10 years away from an individual's life. The progressive course of MS and the related functional damage significantly affects the person's daily activities, their autonomy, and eventually quality of life. Throughout the literature, it seems like women are twice as likely, for some reason, to develop multiple sclerosis, and it is more common in people of Northern European descent. It affects people between the ages of 20 to 50 years, and the average age of onset is young. It's 34. So people can live with MS for a very long time. Now, I'd like to get into some symptoms of multiple sclerosis. These include pain that affects the muscles, nerves, and joints. The person will also experience spasms, stiffness, and muscle cramps. Those are very common. Tremors and sensory changes are also a part of the clinical manifestations of this disease. Other problems that arise as the disease progresses include bowel and bladder incontinence, UTIs, and constipation. Eventually, difficulties swallowing and chewing become problematic. Speech difficulties will emerge later in the course of the disease. Problems with thinking, memory, anger, depression, mood swings, and anxiety are also common. If the individual is bedbound or restricted to a wheelchair, they are then in risk or at risk of developing sores and pressure wounds. A lot to think about. There's my intro to MS in senior care. Stay well.